I think one of the benefits of being here at Vanderbilt is the diversity of background and training. Not everyone that teaches here trained here, and so as a result we get different experience from different walks of life, everything from the private sector to different academic institutions across the country, and even military health systems. So I think that's one of the big benefits of being here, is you get that heterogeneity of thought and training experience.
One of our main goals is to be responsive to dynamic changes in pain medicine. It's a constantly evolving field, both clinically and logistically and policy-wise, and we want to be on the forefront of that here at Vanderbilt as well.
For pain fellowship specifically, Tennessee has been at the heart of the opioid epidemic, and so there's been a huge need to address this issue and a large need for practitioners in this arena.
So we just recently gained expansion for ACGME spots to 5 fellows starting in the 2022 fellowship year. And that includes teaching under 14 different faculty providers and 5 mid-level providers across 8 different locations.
So we really look at fellows as an extension of our family, and we want that experience each fellow has to be unique and to be something that stands out for them.
A little cliche to say, but I think the people is what really made me stick around. In addition to all of the other kind of wonderful training opportunities, my first introduction to Vanderbilt as a resident here was actually as an intern, and it was July I spent at the chronic pain clinic. And so just seeing how the fellows interacted with the residents and the attendings, the camaraderie there, I think is really special. And I felt really fortunate to have that this fellowship year, just kind of having all of those relationships with the attendings and the nursing staff and the nurse practitioners and the x-ray techs. It's a very supportive environment, and I think that's really unique and really special here. So we have a lot of really good bread and butter procedures and patients and everything like that. Your chronic back pain, your chronic neck pain, your knee pain.
We've really expanded our offerings from being a high volume clinical fellowship to really being an all-encompassing fellowship. We have multiple different rotations and expansions that we've made recently, one of which being the new neuromodulation, Center for Neuromodulation that's run by myself and my colleague Dr. Walker, where we focus on increasing the volume and innovation involved with neuromodulation devices, as well as other advanced procedural devices and minimally invasive surgical treatments. We have rotations in addiction medicine and Bridge Clinic to understand that aspect of pain medicine, as well as integrative medicine treatments, which is something that has been widely held both nationally and in anecdotal sense by our own patients, saying that they prefer treatments that are not just based in medications or injections, but other more holistic treatments.
So doing the procedures, which we get a high volume of procedures, along with the diversity of the types of procedures. You manage complex patients because we draw patients from all over the area, including other states like Alabama, Kentucky, and even places like Illinois, things like that. So it's good to see the complex patients that come to us after they've seen multiple pain management specialists in their respective areas.
So our attendings are always there as a sounding board and a kind of a person that we can talk to and a resource to make sure that we're thinking through all of the things as we're learning. But they also really give us a lot of leeway and trust. So whether it's us leading the chronic pain service or us kind of deciding what direction we think a new patient or an established patient's pain care might need to go, they have a lot of faith in us.
Addiction psychiatry service is a one-week rotation where we learn from the addiction psychiatrist about substance use disorder and seeing how we work together on the chronic pain service, because a lot of our patients overlap in that service as well. The pediatric anesthesia rotation consists of the chronic pain clinic along with the acute pain service. So you do a lot of neuraxial and regional blocks on that service for patients who are going to the operating room. On the chronic pain service side, you see patients who have gone through surgery or have chronic pain complaints when they're under the age of 18, so that's a different environment than the adult pain side as well. The palliative care service is also another service that we coincide with, and our patient lists are shared amongst the hospital patients. And so it's really nice to see along how they treat patients with terminal illnesses like cancer or other terminal illnesses, and kind of learn from then on their pain management practices.
I think the Department of Anesthesia and Pain Management really prides itself in being a close-knit department. It's very collegial and there's a lot of camaraderie, and we really enjoy working together both on a personal and professional level, which really makes for a really fun work environment.
Nashville's a really fun town. I think a lot of people see it as a fun town for kind of young people. I have a family, so my experience has been a little bit different, but I love it here because of that reason. There's so many parks, outdoors. You couldn't ask for a better outdoors environment. We spend a lot of time fishing, a lot of time camping with my kids.
I think Vanderbilt has many positives. I think the few that come to mind is one is a clinical experience. We have a strong breadth of experience from both interventional and non-interventional aspects. Interventionally, we have more basic procedures and advanced procedures than many programs in the country. So fellows should feel proficient in performing basic epidurals, RFAs, to spinal cord stimulators, kyphoplasties, DRG, etc. But in addition to the interventional aspect, you get experience in cancer pain clinic, addiction pain clinic. You work with neurology pain trained physicians, anesthesia pain trained physicians, as well as pulmonary pain trained physicians. So having that breadth of experience is something that's very unique on the clinical side. And lastly, we make the fellowship as personalized as possible. What I mean by that is if a fellow is interested in private practice, we try to set you up for success. During your elective time, we try to get you more experience during seeing different clinical aspects, such as going to some satellite locations, working more in the private practice field, maybe even doing away rotations. But if a fellow is more interested in academics, then we take the elective time and try to create a plan where you can build academic projects, build that foundation for your career. So I think it's a multifaceted approach where we really want great clinical experience, fellows to enjoy their time, as well as tailor their time in order for them to succeed in the next step of their careers. I think that's what sets Vanderbilt